And I've been qualified for the last 5 years, but I did graduate entry into dentistry. So prior to actually getting into dental school, I did a degree in forensic science, and that was at the University of Kent. I did that for 3 years, enjoyed it, but always wanted to do dentistry. So then went down the route and the path of doing dentistry at the University of Aberdeen in Scotland. So qualified from there, like I said, 5 years ago, and I've done a range of different jobs since then, which I'll talk about briefly as well. So I don't know, obviously, with the intro that you've just given, the majority of you seem to be either at college or sixth form, from what I understand. But some might be considering graduate entry into dentistry as well. So that's kind of my route and path into it. It took me a long time to get accepted into dental school, to be 2 attempts. And then my journey through dentistry as well was actually quite challenging as well. But, you know, I made it through. So it's not impossible, even though it is challenging at the best of times. So I know we haven't got a long time, so I'm just going to tell you a little bit about the journey in terms of like the work that I do and kind of what dentistry is like for me on a day-to-day basis. So as I said, I qualified 5 years ago. The majority of my time has been spent doing general practice. So working in a general dental practice, doing everyday dentistry. So that includes fillings, root canal, extractions, dentures, crowns, bridges, and things like that, as well as some additional cosmetic things such as like veneers or composite bonding as and when required, basically. But the majority of my work is predominantly general dentistry. But in saying that, I've had other jobs that I've done as well, which is working within community dentistry. So community dentistry is basically dentistry for people who are very anxious, or usually anxious children, or people with mental health issues or learning difficulties. So I did that for a few years as well. And that's usually done on like a salaried basis. So you kind of work in like a health center, and then you have patients who come to you. The majority of the patients that I would have seen at that time were people who were wheelchair bound or had other medical conditions which didn't allow them to be seen in a general dental practice. So I did that for a few years and really enjoyed it as well. I've also done some lecturing as well at the Royal London Dental Hospital, or BARTS as is most commonly known. And I've done that for about just under 2 years as well. I also really enjoyed that. It's been great to work with students and to kind of see a different side of things as well, in terms of like what needs to be taught, because obviously I was once a student, but now to then be teaching students, you kind of have to come at it with a different angle, but then also understanding a little bit how the system works, what they might be looking for from applicants and things like that. So that's kind of been really helpful to kind of have that in sort of my repertoire as well. On a day-to-day basis, like I said, I'm usually in practice. So that means that I'm with patients and with my nurses and other members of the team as well. So dentistry is a team player sport. You're never by yourself. You're always with a nurse, ideally, or additional people, staff members, and it's about having to manage that. And it's really, really important that, you know, you understand that moving forward, because it's not a singular thing that you can do by yourself. You need your nurse to help you. So having the ability to forge great relationships with other staff members is really, really important. So building up a good rapport with patients as well is another really necessary skill as well. Not only rapport with your staff, but also rapport with your patients as well. And then just building on that as well. Because if you look after your patients, then they will literally look after you. And sometimes, I think more times than not, I'm sure everybody else on the call will agree, is that when you're nice to your patients, they can be the best advertisements for you and for your services on what it is that you provide. So it's really necessary. So if there's any things that you do at the minute that can kind of prove that you are a team player, whether it's you play sports or you're on a debate team or whatever it is, anything that you can use to sort of like enhance yourself at interview or your personal statement or things like that will be really, really invaluable. That being said though, dentistry doesn't come without its challenges. So there have been times and seasons where things have been challenging. So whether it's work that I've done on a patient that hasn't gone well and I've had to repeat it or find other ways and means to sort of rectify that, or if it's a complaint that I've had, because I have had a complaint, and, you know, having to deal with that, you know, these things do happen. But I think the biggest thing that I've learned so far in the 5 years that I've been working thus far is that if you make a mistake, which will happen, it's best to admit it. Don't try and cover things up. Don't try and hide things. Just admit when things have gone wrong and learn from it, because that's a really, really invaluable skill as well. But with that as well, it's a very rewarding career. It's a very rewarding profession. I enjoy it. I enjoy what I do. I enjoy the clinical aspect of it the most as well. But there's lots of scope if you want to specialize, if you want to become somebody who owns a practice and runs a practice, or if you want to work in a particular domain within dentistry, whether that's teaching or other aspects like public health, where you don't do any clinical work at all, you just do research. There's a lot of scope. So I would say the best thing about it is that there's something for everybody in dentistry, even regardless of your personality and what you like and what you don't like. You can find your niche and run with it. And that's what I really, really love about dentistry. So I'm trying to keep this brief. Hold on a second. I'm trying to keep this brief. I don't know. That's kind of what I've got to say for now, unless there's like any other questions at the end or anything else that you kind of want me to cover right now, Arnold. Is there anything that you want me to say that I said, or?
So are there any particular patients that stick to memory that were highlights or even a bit of a nightmare?
Yeah, there's been a few, I'd say, nightmare patients. The patients who either make complaints or patients who are just never going to be satisfied no matter what you do. And I've had a few of those who I think sometimes as well, this is the biggest thing that I found, because I don't look my age, I'm older than you think I am. A lot of times patients presume that I'm really young. And so as a result of that, sometimes they felt that they can sort of speak to me in a very condescending way. And you have to understand that when you're the dentist, you are the leader in the room. Okay, so even if you have a nurse who is older than you in age, more senior than you in experience, you are the leader in the room. So ultimately, what you say goes. And you can use that to your advantage. Like, I don't think you should ram that down anybody's neck and kind of have like an ego trip as a result of it. But I do think that you have to sort of exert your authority in a very sort of gentle but firm way. So there've been a few patients who have tried to sort of like overstep the mark and make it seem as if like what they say goes. And as much as I want to give the patient all their options, I will not be coerced into doing something that I don't think is safe. So there've been a few patients where I've had to just sort of, you know, make them know that, listen, I've given you your options. This is what you're asking for. I don't think this is the best option for you, and therefore I'm not going to proceed. However, if you decide to go to another dentist and they want to do that treatment for you, so be it. So just know what your limits are and work within it. Don't feel obliged to do something that you don't believe is safe or ethical, because then it's your neck on the line. So there've been a few patients like that. That being said, the majority of the patients that I've treated have been absolutely lovely. And I think it's nice when you do something for somebody and they come back and say thank you, or they refer your services onto somebody else. And I've had quite a few patients who've come back to new patients who've come to me and said, oh, I was referred to you by a friend who said that you were really, really nice and that I should come and see you. And I think it's always nice when you have nice things said about you by word of mouth. That's a really sort of like positive affirmation. Oh, I can't hear you because you're on mute. I know you're speaking.
No, thank you for that. We're definitely going to get an opportunity to ask you some questions later on.
Cool.
What we'll do now is we'll move to Dr. Chris, who will introduce himself, give us a little summary of his journey into dentistry and then what he's up to at the moment.
Can you hear me, Arnold? Is that okay?
Yes.
Good. So, evening, everybody. Thanks for joining us this evening. I know it's a difficult time, so with the opportunity that Arnold's put here for you, I think it's really good, and it's really good to see so many people, you know, tuning in as well. So yeah, my name's Chris. I know Arnold through university. He was a year below me when we were studying at dental school. So took a very similar path with Arnold and Ruth. I took a graduate entry program. I initially studied biomedical sciences at Lancaster. My intention was always to study dentistry. I applied twice at college years, ASA level, got knocked back without an interview, stayed determined, went through the biomedical sciences route with the ambition of studying dentistry. If I hadn't have got into that, I don't know what else I'd be doing. And thankfully landed on at University of Central Lancashire where I met Arnold and studied at Blackpool for 3 years. I qualified in 2016 and have stayed in the Northwest throughout my early career, and I'm from Preston, live in Preston. I'm currently working in a practice on the Fylde coast near Blackpool in a little village called Lytham, which is really lovely. It's quite an affluent area, older generation there. So at the moment, I provide quite a lot of general dentistry, as well as some orthodontic treatment, as well as some facial aesthetics. So I've got quite a blended day-to-day kind of diary, I suppose, which is obviously on its head at the moment with everything that's going on. But just to kind of give you a brief kind of background to where so as I say, I did graduate entry dentistry, and then on kind of graduating, did my foundation training in Leyland, which again is in the Northwest. And then following that, started working as a locum, which is one route you can go through as a dentist, not having kind of a fixed abode, moving between different practices, which gave me the opportunity to experience a couple of things which I may not have done. So for instance, as I worked in prisons, I provided dental care in Lancaster and Kirkham Prison for a period of time, which was very interesting, and carrying on from where Ruth was with patients. They're a very different kind of patient group, and you've got to be very assertive, and you are very much the leader in the room. I've also provided a little bit of community care, but really with a view to emergency dental care, so dealing with people in pain, particularly in evenings and at weekends, dental trauma, things along those lines. But my bread and butter is general dentistry. I've just come to the end of a 12-month postgraduate program looking at aesthetic or cosmetic dentistry, coupled with Invisalign treatment, which is a version of orthodontic braces. But Arnold's your go-to guy on braces, I'm sure. From my perspective, a typical day for what I do, my clinical day starts at 9 o'clock, but I'm always in work probably half an hour, 40 minutes before, looking at what my diary usually has in place, looking through my notes, refreshing my memory of that given patient. We work in 2 sessions, a morning and an evening, afternoon session, sorry. And throughout the, a typical day, I'll have a handful of checkups, a handful of appointments with gum disease, fillings, it's really blended. And the practice I'm at, we're a really big practice. So we've got 13 surgeries. We're almost like a small dental hospital. We've got typically 8 dentists working in a day, 3 hygiene therapists providing care for our patients with gum disease, children patients. We've also got a clinical dental technician whose kind of focuses on dentures, removable plates, those type of treatments, which really kind of highlights the blend of skills and attributes that the dental team has these days. Not just a dentist and his assistant. We've got a whole range of healthcare professionals working within the dental setting now. And even the role of the receptionist is completely evolving. They're becoming more like a hotel, service on front desk. They make the first impression for your new patients. It's, essential that they're on board with your kind of how you want to approach your dental care, not just the clinical stuff, but these people are clients. They can talk with their feet. They can go down the road and go to the next dental practice. So you've got to really treat them well from the time they enter the door to sitting on your chair and leaving. It's a full service. Most of the challenges I face in a normal kind of setting, if we take COVID to one side, if we have any problems, if I personally have any problems, it always tends to surround some form of breakdown in communication, whether that's either with a patient, with your team members, with your boss. It's always communication based, usually, that I've found. So that's always something, you guys coming into where you are with, whether you're going down the graduate entry route and, A levels, when it's coming to your personal statement and when it comes to your interviews, for me, if I was back where you guys are now, and one thing I'm super keen to think about all the clinical dentistry stuff, but it's the soft skills that, for me, I think make the difference to whether I'm having a good or a bad day. If I've got my soft skills working well, if I'm communicating well, taking on board people's body language, those cues, I think that kind of dictates how my day goes more so than anything else. So, you know, back if I had my time again, I think going through into dental school, going through the interviews, I'd probably look at a focus on my personal communication skills and my listening skills, and how I can develop those to be a better clinician. And that's something I'm learning retrospectively, but you know, I wish I'd had a head start going into dental school. The other thing that I continue to work at, and I struggled initially, is being very reflective. The type of career you have as a dentist, you have to be reflective. You have to think, you know, things go wrong all the time, and working out why they've gone wrong, what you could have done differently. And that allows you to approach that next scenario slightly differently as well. And again, that might be something that's clinically gone wrong. It might be something that you've misread with the patient, or the way you've spoken to any of your team members. You've got to reflect all the time, and that will make you certainly a better clinician, but overall a better person. The other challenges that, you know, for me are surrounding how to make the system work. You know, I work in a mixed practice, so I deliver NHS treatment as well as private treatment. But the NHS system, you know, if you look into it, as I'm sure you will when you're doing your research for your interviews and things like that, that it's quite a challenging system to work in as a dentist. It will probably completely change by the time you guys are, you know, heading into dental school, because it's all up in the air at the moment. And then also as a dentist, you know, if you're in general practice, 99% of the time you're going to be self-employed. So you've got to manage your own book, you've got to manage your expenses, you've got to manage saving up for your tax bill, which comes every January and July, and making sure you've got that right. So, you know, you've got to be self-sufficient, you know, be reflective in how you are as an individual. And you will have challenges. You'll have challenges from the word go, from applying for dental school. As I say, I think Ruth was 2 times, I was 3 times trying to get in there. It's a challenging time for you, but you know, you work hard, and I'm sure you'll all do very well with it. Particularly if you're tuning in on a Tuesday night to see me and Arnold and Ruth, you know, you've got a head start there, I'm sure.
Chris, you talked about being in a 13 surgery practice.
Yeah.
Just as an example of how a patient might come in and all the team members or most of the team members are involved in that patient's care. How does that multidisciplinary approach work?
So yeah, the way that my practice works, it's probably slightly different from I suppose it's not a typical NHS practice. We are a huge kind of machine. A patient will come in and see me for a checkup, and that patient, depending on what their treatment needs are, if it's a simple filling and a scale and polish, or a little bit more detailed gum treatment, they'll typically see me for the checkup, and then they'll be booked back in to see one of my hygiene therapists. If a patient needs a little bit more complex care, and they still need to see, for instance, as a hygienist for some gum treatment, they will do. But if they need a root canal treatment, or an extraction, or a crown, or a bridge, they'll come back and see me. So if there's a blended course of treatment, they'll have a range of appointments, and that can be quite difficult to manage, because patients obviously want their dentistry to be efficient. They don't like coming for multiple appointments. So you've got to, when you're treatment planning and planning out the patient's appointments, you need to be ensuring that it's, and we will need to ensure moving forward that it's minimally invasive, minimal contact, few visits as possible, but ensuring that things are done as efficiently as possible. So typically a patient will come, they'll be greeted by the reception team, they will then be, I always go for my patients. That's one thing I do. I always go to the waiting room to get my own patients. It gives me the opportunity to get off my bum. It gives the nurse the opportunity to start doing a little bit more in terms of cross-infection, getting things those sorted. If you put everything on the nurse's plate, I find that it always gets a bit more stressful. So I take time out. I'll go and get the patient. It means that I can do the chitty chatty stuff on the way back to the surgery. And when we get into surgery, it's almost not showtime, but you've got your dental head on, and you're getting them in the chair, working out what the problems are, and going from there. And then patients escorted back to the reception, and then those range of appointments will be booked if they need them.
And you talked about if you had an opportunity to do it again, you'd work more on the soft skills. How would you advise that these students can work on their soft skills and then show that within their personal statements?
That's a good question. How would I work on it differently? Or I suppose when I said work on it differently, I would probably prioritize them differently. Going into dental school, my head was about how do I cut a filling, how do I take a tooth out, how do I do, which is all very important, but there's a patient at the end of all that treatment, and that patient usually is coming in to see you, is anxious, doesn't like being at the practice. They've got a plethora of emotional things going on, and it's tuning into that. So I think if you're naturally a people person, you'll be fine. But I think, me personally, I think being from a working experience perspective, it depends what you're doing alongside, if you're at college or university, what type of jobs that you've got. I think it's always good if you've got a part-time job, and maybe highlight how your communication is important within that. Or if you were in sports, how communication again is important within that. If you can draw examples of communication, family, friends, there's a range of examples that you could pull, how it's challenging, how it can go wrong, and being reflective in that. I think again, that if you can try and demonstrate that, I think that would always provide good value, particularly in a statement.
Thank you for that. Actually, Dr. Ruth, I know you have the dental student network as well. What are some common things that students or aspiring dentists will fall short on or find it hard in the application process that you think could help these guys?
I think it's when it's coming to put the personal statement together. I think you either someone who's very good at naturally putting prose together. If like English and subjects like that are your forte, then you shouldn't really have any problems. But I often find that people have got the information, they've got all this, they've got the experience, but it's just actually trying to put that in the most succinct way and also interesting, because you have to understand that your personal statement is not the only one that's going to be sent through to these dental schools and admission tutors. There are going to be thousands, and I'm not exaggerating when I say that, not just in the UK, but outside the UK as well. And I'm not saying that to sort of scare anybody or put anybody off, because people are you're going to get through at some given point, but what's going to make you stand out? So it's not saying then do the most wackiest personal statement out there to try and become memorable. That might work, but making sure that everything that you put down leads back to dentistry. Don't put things down that are completely irrelevant. I read some personal statements, they've put things in, it's just like, why have you put that in? It serves no purpose whatsoever, and you only have a certain number of characters that you can use anyway. So be mindful of that. And also, I think it's already been touched on by Chris anyway, but everything that you do, every experience that you have, there's probably something in there that you can pick out and say, this is actually a prime example of like leadership skills, whether it's the most simplistic of things. I know when I was in school, one of the common things was like Duke of Edinburgh Awards. I never actually did that, but I know it's very, very common. So that's a prime example of maybe leadership skills or orientation or problem solving, which you need in dentistry. So don't overlook certain things. And if there is something that you do that's a little bit quirky, whether it's a particular hobby or interest, don't dismiss it, because it might be the thing that makes you stand out from other candidates. So for example, another girl that I knew who was considering dentistry, she did, I think she did like Bollywood or Indian dancing. And she told me that in passing. I was like, that's so interesting. Like, I want to know more about that. But she didn't think it was anything worth sharing. And it was just a little thing that she could have probably just added in just to say it's something like an interest of hers, because her whole personal statement didn't show any real sense of personality or interest. So little things like that, which might make you kind of stand out or make yours a little bit different to the person next to you, could be the thing that maybe gets you the interview at the end of the day. And therefore then the interview is a completely different, aspect of things. But I think you have to take it one step at a time as well. The other thing I'd say really quickly as well, the mistake that I made the first time around with applying, although my personal statement was quite strong, everything else was really weak. So really look at the fine print of what the universities are asking for. If they are saying they want a certain number of A-levels at a particular grade and you don't have them, reconsider applying to those universities. And not rethink about whether or not you should apply there is what I meant to say, because you want to maximize your chances of getting in, not minimize them. So it might be that maybe there's only 2 or 3 universities that you could solidly apply to, because the criteria they're looking for, you have what they're asking for. If they're asking for certain things that you don't have, as much as it'd be nice to think that out of goodwill they might just slip your application through, you have to realize there's other people there who probably will have what they're asking for. And it's literally just running a race. Like if you're running like 100-meter hurdles, there's hurdles you've got to sort of like clear. If you can't clear the first few hurdles, then you just won't make it past the other points. So be mindful of that.
Yeah. And I'll put this question to both of you. Do league rankings matter for universities, dental schools?
Didn't for me.
No, I don't think it matters personally.
So what's so adding on from what you said about picking your dental schools strategically, what would you want in it? Let's say you get some offers. What would you want in a dental school to then go for that dental school over any other dental school? How would you make that decision?
I think, so what I was looking for when I applied from school, like 17, 18, was different to when I applied when I was 21. So when I was applying at 18, I was concerned about the city. I was concerned about where I was going to be living, the social aspects of things and things like that. By the time that I'd already finished my first degree, it mattered, but not as much. I just wanted to do dentistry. So I was willing to go to the most like destitute place if need be, where I had no, obviously I'm saying this in gist, but like with no social setting at all, if it meant I was going to study dentistry, because I knew I really wanted it. So that wasn't as high up on my list. So I think you have to take this into consideration. Are you going to be happy in the place, the location, so the city and what it has to offer? Is that going to be something that you're, excited about? Because you're going to have to be there for a minimum of 5 years anyway. What the course offers and how they teach. Some places are problem-based learning, where it's not so much lecture-based. Others are lecture-based. If you know your style of learning and things like that, and you have the option of kind of choosing, well, I think I'd prefer this over that, consider that. So those are a few things that I would have considered had I got in on my first attempt. But like I said, for me and the route that I took, I really wasn't too bothered. I just wanted a place that was going to hopefully accept me. And the only thing that I was really kind of fixed on was that I really wanted the graduate school. So I wasn't really looking to apply to dental schools where they were just a regular 5-year program. I wanted one that was a 4-year. So I kind of focused my attention on that predominantly.
Ruth, did you find many transferable skills from your undergraduate into your graduate entry training?
Some I did find. I think obviously some problem solving skills predominantly I would have found, and then also like all of it was science based, like the basics of science and things like that I'd already kind of had in my belt, particularly chemistry. Didn't do much biology, so I actually struggled with like the anatomy side of things, but I wasn't the only one in my year who struggled with it. There was quite a few of us, so we kind of just stuck together and put our heads down and got it done. But the chemistry aspects of things I think actually really helped, and some of the physiology, because I'd already done that before as well. Yeah.